Long-term invasive ventilation would obviously be uncomfortable and requires the patient to be heavily sedated to the point of paralysis. It can also exacerbate barotrauma. That is why maximum synchronization to the breathing mechanics and the breath sequences triggered by the patient are so important. Unlike lower-class ventilators, where a mandatory breath is entirely determined by the machine, UVENT ventilators are able to sync with the patient and respond to inhaling and exhaling attempts. Most of the patients are still able to breathe. However, they require help because they are too exhausted to breathe entirely on their own. In addition to synchronization, protective intelligence ventilation modes affect other parameters. The foundation of intelligent ventilation is patient breathing support with automatic adaptation to the dynamically changing breathing mechanics during treatment. In UVENT ventilators, we implemented two intelligent adaptive modes. ADVENT, adaptive ventilation mode with guaranteed minimum minute ventilation. ProVent, the newest adaptive ventilation mode with volume-based intelligent support. Each mandatory inspiration is adaptive. In case of spontaneous respiratory effort, the patient receives additional flow support. After the breathing mechanics data is collected, the ventilator applies optimal settings of breath rate, tidal volume, IE ratio, and synchronization type. By using intelligent ventilation modes, clinicians can reduce the number of readjustments of ventilation settings, which will allow medical personnel to optimize their workflow and devote more time to patients.
Visual monitoring, the Dynamic Lung-Heart Widget. To enhance the clinical utility of the ADVENT mode, UVENT ICU ventilators incorporate a Dynamic Lung-Heart Widget. This visualization tool transforms complex numerical data and waveforms into an intuitive graphical interface, allowing for one-glance monitoring of the patient's cardiorespiratory status. While traditional ventilators require clinicians to mentally synthesize multiple scalars and loops, the Lung-Heart Widget provides a real-time integrated anatomical model. This is essential for maintaining a clear overview of the patient's progress without getting lost in data noise. The Dynamic Lung-Heart Widget effectively acts as a flight director for the clinician. By mapping mathematical parameters onto a recognizable anatomical model, it ensures that changes in the patient's condition are noticed and acted upon much faster than through traditional numerical monitoring alone.